Well, after the sudden passing of actor and comedian Robin Williams, there is, of course, an outpouring of grief and reflection from people everywhere around the world.
But as we remember Robin, we can't forget some of the bigger issues that were at hand, and that was how he was fighting his depression. Maria Bussi is here this morning to talk about depression, some of the warning signs, and how we can all help, or maybe how we can help ourselves. Good morning.
Good morning.
Now, it's a difficult conversation to have.
Yes. As a licensed professional counselor, you've seen this often, I'm certain. Are you seeing it more in women than men? Is there a differentiation there?
I think it affects people differently, all people differently. I mean, there's some components to it, which is genetic, and it could be like if after a chronic illness like Robin Williams, it's like sometimes there's depression when you've had a chronic illness. He had open heart surgery and had some heart problems. And also sometimes when, you know, family members are depressed, it kind of can genetically and biologically be passed down, you know, in families. So I know it's important to kind of really watch other people in your family, especially when they might be, you know, having depressive kind of symptoms.
Right.
Well, what are some of those symptoms? I mean, Robin Williams, given how funny he was always on, and he was, at least in his public persona, always seemed to be very happy. How do you recognize those symptoms if somebody may be trying to cover them?
Exactly, like wearing a mask, because on the inside they might be really sad and having depressive-like symptoms, but on the outside they show such a great, you know, personality and having a fun, you know, kind of disposition. But I think that sometimes, like in behind the scenes, especially if you know the person, their behavior is pretty consistent because they can be like having changes in eating habits and sleep habits, and over time, it's important to watch that person over time, because we think, oh, it's just an episode, but some people have it for a lifetime, and he did.
Yeah, yeah. You know, it's interesting to me, and we talked about this earlier, how sometimes it's these people that are such performers, and they have such highs, and they have such basement lows. And is that more of, I mean, you can't give us any diagnosis, but is that like a bipolarish or a manic type?
Exactly.
Type thing? Yeah.
You're right, Sean, because he is so high and so low. When you watch him on all the funny things that he did, even on sitcoms, or even with like watching him on Ellen, he doesn't sit still very often. He's very distracted. He doesn't kind of want to go into a genuine, you know,
conversation,
serious heart-to-heart talk.
Right,
exactly.
Right.
So it's always like kind of distracting for him to just kind of make things funny, and that is a coping mechanism.
So how do we help? I mean, we just talked the other day about sometimes you need to let folks just be sad for a day or two and get past. This is much more than that. How do you help someone who's in that kind of situation?
And I think because they're so exhausted and they feel a sense of helplessness and that they're not worthy of help, having family members be gathering them, you know, around them and be able to do an intervention and take them to a family physician, or like we have sources here like Dublin Springs has a treatment center here in Dublin.
Mental Health America, Franklin County.
Exactly.
They do great work.
And looking up, like on the internet, like what signs and symptoms there are, and talking to your family physician and finding the help that you need, because children and sometimes adults have different needs.
Is that something that, let's say you get the family together and you've decided, all right, we're going to do an intervention. Do people react well to that usually, or do they push back?
Sometimes they do, but I think it's for their best interest in saying, do you like the life that you're living right now? And this isn't what we, you know, want for you, and we are going to get you help. Sometimes I think they are going to be resistant at first, but I think in the long run, it's like a quality of life. And we really need to focus in on that, because it is for like some people, it might be one episode, or it could be a lifetime. It can be chronic.
And drugs and alcohol do complicate everything.
Absolutely. And I think he had some issues with that too.
Yes, he did.
Yeah.
Thank you. Appreciate it.
It's my pleasure. Thank
Hopefully
you.
that'll bring some other people some ideas and maybe some help if need be.
Stay with Fox 28 for continuing coverage of Robin Williams' sudden passing. We will have updates both on air and online at myfox28columbus.com.
And we will be right back.